Hi, it's Sonia. Congratulations, you had your baby. So everything that you could do while you were pregnant in the last video I did, you can continue doing now, leaving this area alone, depending on if you've had a C-section or not. You might be able to start doing some hands-on and just kind of like gentle massage into the stomach. For if you had a C-section, and starting up higher, trying to feel if you feel stiffness or tension or I don't know the right words to it, but as you get close to the scar, you might feel it harder or more inflamed. So you're probably 2-3 weeks out, hopefully, before doing that. If you had a vaginal birth, you probably aren't going to have that same thing. Don't go trying to bounce back, because your pelvic floor is the weakest part, and you're going to be able to strengthen everything else more than and too much, and then your pelvic floor is going to fall way behind and you're going to end up setting yourself way back. So can you just give yourself 6 weeks until the doctor approves you, especially if you've had a vaginal natural birth. So what you could do is breathing. So I'm 14 months postpartum, but what you want to do when you breathe, I just still can't it's not like extra skin or anything, it's just still not right because I was cut with a C-section, but it's good to, so if I inhale here and then exhale and breathe in. So this is just all I did the first 6 months, was just look at how I was breathing. So you can pull in. I don't want you to pull in through here, and see how it tucks my pelvis back a little bit. That's what I don't want you to do. You're gonna keep here and try to use the breath, and then just at the desperate finish of the exhale, you should feel the muscles gently contract, but you don't want to create rigidity. You want to create suppleness. Inhale and exhale. So here's my belly button, and that's where I wanted to be pulling in here. So not in and up, nothing moves from my spine. You're just trying to breathe to get the elasticity, to remember, to try to get everything to refamiliarize. Then if you have a towel or a block or a ball, you can come and lie on the side, and you can do these gentle stretches, especially if you're nursing or even just holding the baby. We just get so tight through here that all of this stuff, you're just trying to be gentle and still. The fascia is just so important in hydration. It's going to help you nurse if you're breastfeeding, and your recovery even if you're not. And if you get tension up in the chest or the upper back, all of this is going to help release it. You can put the ball in your neck and really wedge it in there, because if you're looking at the baby a lot, it might just help you to kind of get the tension out. You can put it on the jaw a little bit more if you're clenching. But just aim, for just a couple minutes of releasing, and breathe and sink into it. Just start this. Try to do it, when you need to, even once a week. And then as you then start to get closer to the 4, 5, 6 weeks postpartum, you might be able to contract the abdominals a little bit more and then release, and then contract a little bit more and then release. You can start to go for walks. You can do bridges where you just lift your hips up and come down. So then you're just trying to get your butt stronger, which could help balance out the pelvic floor. You can really try to do that. And then depending on if you had a natural delivery or not, which I did not, I sat on this ball a ton because it just helps the pelvic floor. Honestly, I can't tell you much about vaginal birth and the recovery on that you might need to hopefully have done it before to know if this feels good. I would really wait. If it doesn't feel good, abandon it immediately. Don't do it. You can sit on a towel like this, rolled up, and do it. The block is probably too intense if the ball doesn't feel good, but 6 weeks, it might even take you longer to be able to sit like this, but just extend kindness to yourself, because It's crazy how dangerous and intense pregnancy is, but so many people go through it that it's just like another day of extreme trauma to the body. You know, C-section is the biggest surgery you can get, just cutting all of those things. And how many people have a C-section scar? So then when you have the C-section scar, pretend the scar's here, you can also put traction in and start to stretch it out, but I would really wait until there's a nice good bond there. So, you know, closer to 4 weeks. So as you're just massaging and getting lower, you can start to just feel if there's any adhesions leading up to the scar tissue. And then you can start to explore on the scar tissue and just very gently, very slowly going across. You might find some strings, some bundles of adhesions, and you might pause and sink in there and then continue going. And you might not be able to go at all parts. You might, you know, have an adhesion and kind of release it, but the more you release the scar tissue in the big picture, the better. But that doesn't mean you have to go working on the adhesion now. You can go above it, you can go below it. Might take you a couple of weeks just to not have bruising if, you know, there was more happening. Yeah, and sometimes the epidural site can really be really painful. Maybe you need more towels or pillows to prop you up when you're nursing, because I know that really hurt me, and then I realized it was position, but also epidural. So be kind to yourself. This is what you could do for 6 weeks, and then I'll make another video about what you can do even more postpartum. But I also have other videos that you could do lying down. They're 10-minute videos or 20 or 30-minute videos in there, and all of that should be pretty good to just slowly build up to. Congratulations, you did a great job.